My name is John Taliaferro. I'm an orthopedic surgeon specializing in adult reconstruction and sports medicine with EmergeOrtho here in Wilson, North Carolina. So ACL injuries are an extremely common part of the sports medicine world and obviously make the news around the country. We specialize in sports medicine here and taking care of our injured athletes and even our injured weekend warriors. ACL reconstruction or repair or procedures that allow the athlete to return to their sport or activity of choice as they recover. We specialize not only in that procedure, but also in terms of the overall recovery, because not only is the reconstruction obviously very important for the athlete, but their overall physical therapy is extremely important to allow them to recover at an appropriate pace and allow them to return to the sport of choice. Other injuries like meniscal injuries or cartilage injuries can also be seen with different sports problems, and we're able to specialize and take care of those injured athletes with either meniscal debridement or repair or even certain cartilage restoration procedures. And all those allow us to get our athletes back to life and doing the sport they love. We're fortunate enough here in the Wilson area to have a very good working relationship, a very close relationship with our physical therapist. As I tell my athletes, it's not just the surgery that's important, it's their overall recovery with therapy that's going to be really allowing them to return to the sport they want to. PRP or platelet-rich plasma is another adjunct that we have in the sports medicine world to help with specific tendinopathy issues, chronic issues such as lateral epicondylitis or medial epicondylitis, also known as tennis elbow or golfer's elbow, can be a chronic and very annoying condition for patients. Patellar tendonitis, even rotator tendonitis, can limit a patient's overall ability to participate with activities. Fortunately, with PRP, we can use the patient's own immune system to help not only treat the pain, but heal the overall tendon issue going on. Here in the Wilson office, we're able to provide that care for those patients from all walks of life with all sorts of tendon issues. Using that newer technology, we're going to get our patients not only their pain better, but help them return to the sport that they love. So we're fortunate enough as a group to have a partnership with the Wake Med System and Capital City Surgery Center in Raleigh, North Carolina. That allows our group to provide hometown care, but with some of the latest and most advanced medical technologies available in this part of the state. With our partnership, we're able to perform same-day and overnight surgeries, including total knee, total hip, partial knee, as well as sports medicine procedures. That partnership has really allowed us to bring some of the latest and greatest procedures and technologies to not only Wilson, North Carolina, but the eastern part of the state itself. Patients who would be a candidate for same-day or outpatient surgery would be a patient with good overall health status and also a big family support or friend support at home that would be amenable to assisting them after surgery. And the goal there is to allow the patient to, instead of being admitted to the hospital, be able to go home the same day after surgery. And this not only allows the patient to get out of that acute hospital setting, but letting them start outpatient physical therapy almost immediately. And this is leading to not only better pain scores, but better range of motion and also overall better patient experience. So instead of the patient being in a hospital setting, they can be at home with families and loved ones much quicker. And that has, many patients will let us know that that's an overall better experience overall in their surgical time.